RCH application. So these are just the number that are provided state-wise. Please let me know if you want me to stop at any of these slides. I must congratulate especially Tripura, who have managed to cover 100% of their facilities. Lakshadweep, and then some states like Ladakh, Kerala, they are approaching 100%. Punjab, Daman, Uttarakhand. So this is the status of the health provider registry. So these are the distribution of the type of health provider that the state have managed to onboard till date on the RCH 2 application. So I see a good mix of ANMs plus CHOs plus other health service provider. These are the status of state-wise again for the health provider registry. So the second column is the health providers that are HFR seeded. So our first priority was naturally to onboard the health providers first. But we need to also move on to get the 100% saturation towards the HPR seeding of the health provider. Because ministry has taken the stand that we need to make this health provider and health facility registry clean. Many applications are giving, and all the applications are giving the different results for health provider numbers and the health facility numbers. Application 1 is saying that we have X number of facilities. Application 2 is saying we have Y number of facilities. So we need to go beyond this and we need to have one sacrosanct database, and that's why we have made this RCH application completely dependent on the ABDM system, because ABDM maintains one single source database for the health facilities and the health provider. So I would request all states again, to those who have not reached 100%, please reach 100%, because the data entry would be completely dependent on those facilities who are HFR seeded and by the health providers who are HPR verified. And this chart is just the graphical representation of the table which we saw in previous slide. So the blue bar shows the number of health providers registered, irrespective of the verification status. And the orange bar shows the health provider verified against them. So I think I should skip these slides. These are just the distribution. So this particular graph I wanted to discuss. If you see the example of Tripura, Punjab, Karnataka, Chhattisgarh, Mizoram. So these states, I think they have done a good job by ensuring that there is a good mix of ANMs and other service provider also. I mean, many states have taken efforts to onboard the health providers very diligently, but my stress is upon the fact that we should not focus only on onboarding ANMs, because RCH 1 was, the approach of RCH 1 was the area-based service delivery, but the approach of RCH 2 is completely different. We are moving on to the service-based application. So whoever you may think, whoever may or state give the right to do the data entry into the application, be it the CHO, be it in the medical officer, be it the lab technician, even if the HOD of a department, if the state thinks that they may enter the data into the RCH application, please onboard them based on their HPR IDs. So we should, if we approach towards that direction, we will see the distribution like Karnataka, Mizoram, Chhattisgarh, these states are displaying. So this is the feedback that we got during the training session conducted in January 2025. So this number is not visible here clearly, but you may see on your mobile phone or on the smaller display screen. So these are the distribution of the different types of participants that gave the feedback. So again, the percentage distribution of the same. And this chart shows that more than 90% of the participants in the training session, they shared that they are very excited with the RCH 2 application, because the UNICEF and ministry and along with the LTI team, they have taken much effort to ensure that the RCH 2 application should be smooth compared to RCH 1. Much of the data entry efforts have been reduced, much of the workload of ANM we have tried to reduce it. We have made it quite simplified that we don't need to fill up the complete detailed form. We want to use one single module in the application. So same distribution is now shown state-wise. The 6 states till 17 June we were able to provide training to 6 states. That's why the data here is only of 6 states. So these are just the feedback provided. This is the distribution of the type of users that are doing the data entry. So again, you see the green graph. These are the excitement levels that are shown by the participating states who participated in the beta testing of the application. Now, if you see, almost 95-99% of the participants are saying that RCH 2 application will be very useful for them, not only in terms of reporting but also in terms of service delivery also. These are some of the glimpses from the training that we conducted during the beta testing. These are the testimonies of some of the ANMs that participated in the training.
मेरा नाम जया प्रकृति, मैं चकता ब्लॉक से SC सामग्री का बेहतर हूँ, क्योंकि आज हमने यहाँ पे भारत सरकार द्वारा जो RCH पोर्टल के बारे में 0.2.0 के बारे में समझाया गया, बहुत ही अच्छा था। लेकिन सर इसमें ये है कि जब हमें जैसे समझाया जाता है तो मेरा मानना है कि थोड़ा सा एक टाइम में थोड़ा मतलब चीज़ें एक ही बार में सारी चीज़ें नहीं हो पाती हैं थोड़ा जाके। और दूसरी चीज़ ये है कि इससे मतलब हमारे जो ग्रामीण इलाके हैं उनको काफ़ी मतलब सपोर्ट मिलेगा। जो बच्चे मदर जो भी हैं सबका मतलब डाटा क्लियर हो सकता है। और सर एक चीज़ हो है कि अगर ये चीज़ें ऑफलाइन होगी तो मतलब ज़्यादा साथ ऑफलाइन भी होगी तो ज़्यादा बेटर है, क्योंकि सर वहाँ पे लाइट का इशू होता है। और मतलब क्या होता है जब हम आते हैं तो नेटवर्क इशू होता है, तो और जो यूनिट वाला होता है हमारा RCH होता है उसका समय अवधि जो होती है वो थोड़ा बढ़ा दी जाए। जैसे उसमें होता है 15 डेज का, तो 15 डेज में अगर नहीं हो पाया तो फिर वो रुक जाते हैं।
These are the broad feedback that we received during the beta testing. 99% of the issues have been addressed. HRP tracking and management tracking is already there, but management module is under development. VHND session creation and work plan, this we have already showcased in the PPT that Dr. Ajay Thakur mentioned in the morning session. ASHA onboarding by ANM, it's already in the application. Provision of BAL Aadhaar creation, discussion with AVDM team is going on. Offline data updation, that is under development. Monitoring by medical officer, that will be done once the report module is live in the application. Beneficiary registration by ASHA, this is one of the major deviations that we took in comparison to RCH 1. We have given the provision of registering the beneficiaries by ASHA workers also. Those beneficiaries will automatically be reflected under the ANM to whom that ASHA is tagged. So that will reduce the burden of beneficiary registration by ANM. LMP editing option, this is one of the debatable point, because should we give the editing option or not? Because if we give the editing option, just imagine the cascading effect that it would be having in the work plan of the ANMs. Suppose down the line of 6 months or 7 months, if you edit the LMP date of the beneficiary, entire work plan would go haywire. So it's still a debatable point. I think if we give the LMP editing option, it would open a Pandora box. So I don't think we should accept this feedback. And then inclusion of 15 days window, which we have already done. So these are the broader feedback that we got. So yeah, this was the, and last I would like to highlight this particular slide, wherein I would especially like to call upon Bihar and Jammu Kashmir. Reason why Bihar, because See, total 35,000 beneficiaries have been registered in the beta testing phase. There is too much. Bihar alone have done 23,000 beneficiary registration. And Jammu Kashmir, why? Because we have not conducted beta testing at, the field level training in Jammu Kashmir. They themselves took the application at the field level, they themselves did the beta testing of the application. And it doesn't mean that I am undermining the efforts of other states. They all did a good job in accepting our request that they have pursued their field level workers, they have tried to do the beta testing diligently. But just I wanted to consider these two states in particular because it seems they have done some extraordinary job. So that's all. Thank you.
Thank you, sir, for laying the foundations of today's